Hi, welcome to the series of testimonials from our patient. We have chosen to bring you real doctor and real patient rather than somebody who looks gorgeous and is telling you something that you don't know if it's coming from the horse's mouth. I am Dr. Narendra Gupta. Welcome to the testimonials, and I have a patient of mine that has been a patient for some time. It's been a pleasure looking after him. Why don't you tell us a little bit about yourself and what made you and how did you find out about the Diabetes Hypertension Center?
Okay, I've been a patient of Dr. Gupta probably a little over 2.5 years. I came to him, I was having some complications due to diabetes, poor management on my behalf and some misinformation when I was first diagnosed. And when I came to his office, he sat me down and he said, the most important thing is that you get better and we improve your quality of life. And I never had a doctor to put it to me like that. It was just really important. He said, we can do this, but you have to do your part and I'm going to do my part. And from that point on, he's been right at my side on every issue, any little problem, close testing and monitoring to try to get my insulin dependency down and my blood sugar level controls better, and it's worked dramatically. I probably had A1C levels of 9%, and I think the last time my A1C was 7.9, which was considerably good compared to what it was before.
So tell us a little bit about, you've had multiple vascular problems, and you're not very old, you're a young person, and you've had vascular episodes related to your heart and central nervous system. Yeah. Tell us about them.
When I was actually away working for a company in Phoenix, Arizona, and I began having some problems breathing and some left quadrant chest pains, and I was only 34 years old at the time, and I went to the emergency room, and they kind of looked at me like, well, you look to be okay, we don't know what it is. So they went into a cardiac catheterization, and they saw where I had 3 arteries that were 98% blocked. So they had to perform emergency open heart surgery, and they had to go in and graft 3 vessels. So that was due to the diabetes, being a diabetic for years and having poor management of it, and not necessarily being as proactive as I should have been in my care. And Dr. Gupta told me something that after I started seeing him, he said, I wish I could have seen you 5 years ago. We could have avoided that. And I really and truly believe him.
How has your cardiac disease done? And I understand you had some EECP treatment, which is a rather unusual form of treatment. Tell us your experience of EECP and how's your cardiovascular disease doing?
The EECP, I had never heard of it prior to coming to Dr. Gupta's office, and my cardiologist had never mentioned it. So when he said, well, this is something that may help you, and I was like, well, why? I said, well, I really want to get better, and I really want to slow down this progression of this cardiac disease, and make it get my quality of life to a certain point. And the EECP treatments were amazing. My blood pressure went from averaging maybe 144 over 95 or 100 to where I'm about an average blood pressure of like 120 over 80, and you feel better. I mean, because you feel better because the treatments are actually opening up vessels that are collateral arteries around the heart, so the heart is getting more blood, and you actually feel like you have more energy, and you're more relaxed. You feel like you're getting better and not worse.
So since the EECP treatment, have you had any further chest pain? How about your exercise ability and cardiac status wise? How do you feel?
I feel considerably better. I probably started out prior to the EECP treatments, I probably was doing maybe 5 or 10 minutes of exercise, maybe once or twice a week. Now I'm up to about 5 days a week of exercise at about 25 minutes each day. So I mean, my energy level has improved considerably as opposed to prior to this.
And how's your blood pressure and cholesterol been in the last 1 year?
The cholesterol and my blood pressure have came down considerably. My blood pressure is it's been averaging 120/80, which is right at a normal blood pressure. And as opposed to prior to being under Dr. Gupta's care, I was about 144/100 on a regular basis. So it's actually came down a considerable amount.
How much insulin are you using, and are you able to treat your diabetes? You have a better understanding of diabetes now, would you say that?
Oh, yes. My insulin, I was taking about a total of 100 units per day, divided up over twice a day. Now I'm down to about 65. So, that's a 35% drop in the amount of insulin that I'm taking now. So, but I definitely understand the way the insulin and the eating affects the way your body uses the insulin. So under Dr. Gupta's guidance, he's actually showed me how to eat better along with the insulin, which doesn't require as much insulin. So it's been a good experience. I have no complaints.
One of the key things that often gets debated, that we can prevent this, we can prevent that, but inside your own body, how comfortable are you with yourself compared to the guy that came first to our office? Could you comment about that?
I just feel like I know so much more. I feel like the knowledge has given me a sense of control over the disease that I didn't have before, and I feel like Dr. Gupta guided me down that way to help me putting the information and the things in front of me to take advantage of. So as how I feel as it relates to my knowledge and what I've gained as far as being a patient, I am immensely happy.
Very good. I really thank you for taking the time, and I want to wish you very good success with this thing. But the key is in your hand. You are on the driver's seat, and you are the boss. I do not treat the diabetes. Would you agree with that?
Oh, yes. It's the patient. I mean, the doctor can't do it. The doctor can be proactive in his treatment, but he can only put so many things in front of you. You have to take advantage of it. You have to follow the diet. You have to follow the exercise regimen. You have to follow the portion control. You have to do your part. It's not going to happen through osmosis. It requires effort. But after that effort is put forth, you will receive a reward.
Let me hear your message to a lot of young kids with type 1 diabetes. What would you tell them to increase their confidence, give them hope that they can be successful?
For those that are type 1 diabetics and they're young in age, read about it, learn what it is, what your body is and isn't doing, and then learn what you can do. Don't just take secondhand information from people that may have had the disease. Actually go out and be proactive in your information search, and also ask your doctor questions. Put pressure, well, I call it pressure. Put pressure on the physician to give you the answers that, okay, well, doctor, I'm a diabetic and I want to know what can I do. And a good physician will put options in front of you that will allow you to increase your quality of life.
Thank you very much, talking candidly about yourself and your experiences. I really appreciate this. We look forward to many, many years of friendly relationship. Thank you. It's been a pleasure looking after you.
Thank you.